ስለዚህ በፍጥነት ከዚህ ምን ይላል? የነሱ መጣ
Good afternoon. I hope you can hear me, right? I
Yes,
see that we
correct.
have, okay, thank you. I see that we have around 70 participants. I want to make sure if the session, since it's an extension of the previous webinars, I want to make sure if this is not going to be something very new. So please in the chat box, please drop if this is your first time attending this webinar series or you have attended the previous ones. So if you have attended the previous webinars, at least one or two, you can say yes. If not, you can drop no. I just want to have a quick assessment. Say okay. I think most of you are new for today. So I strongly recommend for you guys to go back and read some of the webinar slides, but in the meantime, I'll try to make sure most of the concept is not new for you, especially the terminologies and others. So you can go back and refer that. Emma can share the slides after the session, or I don't know, in the meantime. So I think it's better if I start. So in today's session, what we are interested in doing is to see data analysis principles and steps, not the details of the analysis, but the common mistake that we make is when we jump into running the analysis. Before that, there are some basic steps and principles that we should understand so that we can do a very good analysis and reach at a conclusion. So just to refresh your memory, research is a systematic collection, analysis, interpretation of a data to answer a certain question or to solve a problem. So in this process, we have a problem. We always start with a research question or a problem. To solve that, we design our protocol or we write a proposal. And then for that, we need a data, which we have to collect systematically. Finally, we have to analyze our data so that we can interpret the results and hence apply it for to serve as an input for the practice. So data analysis is a very critical bridge between our problem and the data that we collected and the results that we seek to have. So it's very important to make sure that we do a proper data analysis so that we can get a very credible result that we can use for to improve their practice. So the way we define data analysis is it's a systematic process of applying statistical techniques and logic to a well-managed data to answer our research question. So simply data analysis is it's a process by which we make a meaning out of our data to answer our research question. But before that, the raw data that we collected cannot be always suitable for analysis. So we have to make sure that our data is well managed. That's what we have tried to cover in the previous two episodes of the training with the SPSS demonstration. So please go back and refer that. So after we manage our data very well, we apply statistical methods and logic to answer our research question. So when we usually talk about data analysis, yes, of course, like most of the time what we're talking about is a statistical analysis method, statistics, but we don't apply statistics 100% of the time to answer our research question. We have to use it in conjunction with logic or simply our scientific knowledge. So without applying our clinical knowledge, if we rely on statistical techniques like 100% of the time, the result we get might not be clinically meaningful or suitable to be used. So we have to apply logic to our analysis, which we will see in the subsequent sections when we run the analysis step by step. So simply data analysis means making a meaning out of a raw data. So just to repeat it again, if we have a research question, to answer that, we collect raw data. Before analyzing it, we have to manage it. This is a very critical step. Without doing this, it would be very difficult to analyze our data. Yes, technically it's easy. If you give a software any sort of data, it can analyze it. That's why we call statistical softwares garbage in, garbage out. If we give them any sort of data, they can analyze and give us the results, but it depends. The result that we get depends on the quality of data that we fed the software, not the statistical software capacity. So we have to manage our data to get a good results. Then we analyze it. That means we answer our research question. And research doesn't stop here. After we answer our research question, we have to use it as an input to make an informed decision. That's the whole purpose of research. If a research stops here after answering the question, if it stops here, if we don't disseminate it, if we don't make sure that it is used as part of the practice to guide decision-making for the clinical, for the policy, and any other purposes, then it's useless. So always make sure that you disseminate your result findings. So how do we make a meaning? Data analysis or the process of making a meaning has different levels or steps, which is as follows. The first one is when we collect the data, we have to make sure that, I'm sorry, someone is writing on the screen. I'm sorry. So the first level of analysis is describing our data. So when we have a raw data, the first analysis that we do is describing the data. That means characterizing the study population based on all of our studied variables. Every variables are characteristics for which we collect data for our research. For example, it could be age, gender, medical condition, our outcome variable. It could be length of hospital stay or any other confounding variables for which we have collected data. They have to be characterized and presented in our study. So the terms exposure and outcome are exposures are simply maybe the routine term that we know is independent variables. These are variables that could affect our dependent variable or our outcome. So exposure and outcomes are our study variables for which we're measuring their characteristics. So outcome is the dependent variable, exposures are the independent variables. So every study or research type, whether qualitative or quantitative, and in quantitative, we have different study designs starting from case report, from the descriptive up to the analytic ones, experimental study. We have to make sure that we start our analysis by describing the data. This is a critical level of data analysis that any research should have. So this is mandatory. It's like presenting your data by saying that among the study population, this much percent was female, and this much percent was from urban area. This much percent had comorbid illness, stuff like that. This is a basic description of the population that you studied. It's very important. So every research should start with that. The second thing that we do is comparing groups. So what do we mean by that? We compare the characteristics of our study population based on their outcome status or particular exposure of interest. I am sure you have seen tables like this where there are a number of characteristics. It could be study population with the exposure, study population with no exposure, and there are a number of factors here. It could be age, sex, DM status, medication history, and then we compare the two groups to see if the exposed and non-exposed groups are comparable or not. We usually do these types of comparisons to make sure if X and Y are the same, or if X and Y are different, if there is some sort of pattern between two variables, in order to make sure that our groups are comparable. We usually do this in analytic and comparative research designs. Analytic comparative research designs are designs where there are two or more population groups that we study within the same research. For example, in a cohort research, what we do is we start by recruiting groups with some sort of exposure and another group with no exposure, and we compare the two groups and try to see if there is similarity or difference between the two groups. And the other comparative research is case control design. So if we are running a case control design, before answering our research question of the relationship between exposure and outcome, we usually compare the cases and the controls to see that if these two groups are comparable or not to begin with, so that it will give us an information if what we are trying to analyze, what we're trying to infer from the study population is in fact fair, because when we do this analysis, we'll pick if there is a big difference between our groups or not. For example, if we are studying the effect of smoking on lung cancer, and let's say our study design is a cohort, that means we started by recruiting participants who are smokers, and we started by recruiting smokers and non-smokers and try to see if smoking causes lung cancer in 10 years follow-up. So if the group which smokes is composed of mainly old population and male with other comorbid illness, and the non-smoker group is like the opposite, like very young, mostly females, and no other comorbid illness and other health stats are very good, these groups are not to begin with comparable. So we can predict that eventually, definitely, the lung cancer will be more prominent among smokers, because the groups have other risk factors in addition to smoking, which is old age and their gender, and something that can compromise their immunity, other comorbid illness and stuff like that. So if we want to make sure that the variable that we're studying has a pure effect on our outcome, we have to make sure that the groups are comparable on all other variables other than their exposure status. The same works for case control study. We have to make sure between the cases and the controls, all other things are comparable, so that that particular exposure is truly, to make sure that that particular exposure is truly associated with the outcome. So comparative research designs, cohorts, case control, experimental studies, and comparative cross-sectional studies are studies where we're like actually expected to do this type of comparative analysis. But sometimes in other types of studies where we don't have separate groups, we might also do, in other analytic studies, we might also do this type of comparison, but it's not mandatory. So in a routine cross-sectional design, it's not mandatory to do group comparison, because we don't have, we only have one group of study. We don't classify them based on their exposure status or based on their outcome status. So there's nothing that we have to show for the audience if there is fair comparison between groups, because we don't have separate groups. We only have one big study population. So the third thing that we do is building relationships. So when we try to build relationships, what we're trying to do is identifying if our exposure affects our outcome. So if the exposure affects outcome, that means we want to see if X affects Y. And like here, what we are trying to do is we're trying to look for cause and effect relationship. People usually confuse comparative analysis with analysis that are used for building relationships. In this case, what we're trying to do is just a one-directional association. If X causes Y, if X affects Y. But in the comparative group analysis, what we're trying to do is we are trying to see if X and Y are similar, or if X and Y are not similar, so that after comparing that, we will have a baseline assessment at hand, based on which we can do further relationship analysis and infer the presence of relationship between the exposure and the outcome. So this is something that we definitely do only in analytic research designs, because assessing relationship is what defines analytic research. So it's something that we do for cross-sectional, case control, cohort, and experimental research, but not on descriptive analysis research like case report, case series, and ecological designs. So to describe our data, compare the groups, or build relationships, we have to use statistical methods. And the statistical methods that we use to describe our data is called descriptive analysis. And to compare our groups, it's an inferential analysis, particularly inferential analysis called comparison analysis. And the third one, to build a relationship, we also use inferential analysis. That means particularly regression analysis. So in descriptive analysis, there is no p-value. What differentiates descriptive versus inferential analysis is, in descriptive analysis, there is no p-value. You don't see p-values. Just describing it in terms of percent, in terms of mean, in terms of other summary measures, but there is nothing of statistical comparisons like p-values. In inferential analysis, since the point is to infer some sort of relationship, there are always associated p-values, just a simple tip. So inferential analysis goes beyond describing the data. It compares, it builds relationship. So when we compare, to say there is a relationship or not, there is similarity or difference, this value has to be accompanied by a p-value. So in inferential analysis, there's always a p-value, but the type of analysis that we do for comparing groups and for building relationship is different. So let's see them. So what are these specific statistical tools that we use for at each level of analysis? So today what we're going to cover is just to get familiar with the whole analysis procedure, not specific details. In the subsequent webinars, we're going to see the details of the analysis with a space demonstration using real data. So just to summarize what sort of analysis tools that we have, I'm sorry, Emma team, if there's anyone, maybe if I miss comments or suggestions on the chat box, can you please take a look at that and inform me? Since Data is not around, I might miss some of it. So thank you. So the first, to summarize or describe our data, which is something that we should do for any research, we use different descriptive statistical techniques. So depending on the type of variable that we have, whether it's categorical or numerical, we have different ways of summarizing our data. So what we're doing in descriptive statistics simply is we're trying to put a summary of each variable. For example, for gender, we might summarize it by saying 59% were females and the rest were male. And for age, we can say the mean age of the participants was like 37 years, plus or minus like 3 years or something like that. So this is a summary of our raw data. What to use, when to use, it depends on whether our variable is categorical or numerical. So the frequently used data summarization techniques or tools are, sometimes we can just report the simple count. We can say that among the 500 participants, 127 died. We can put the raw number as it is, but the common ones are, and we can also put it as a ratio, but the commonly used ones are proportion. One I have put here, like we have 59% were females, 89% were with comorbidity, they took medication and stuff like that. The other is rates. There are two different types of rates, prevalence rate and incidence rate. Since we're going to cover the details, I'm not going to explain further on this. So if we have a categorical variable, we can present it simply as we have this much number of cases, or we can present it as a ratio of male to female or comorbid and non-comorbid cases, and any other two-group presentation. We can also present it as a proportion or as a rate, like prevalence or incidence rate. So if we have numerical variables, the common summary measures that we use are mean. And if you use mean, you make sure that you present your result with standard deviation or median, which should be presented with interquartile range. We'll see it in next session, but just to give you a simple tip, mean is a proper summary measure that we should use when our variable is normally distributed, like this bell-shaped curve. When it's a skewed data, when we don't have a symmetrical data distribution, the proper summary measure for a numerical variable is median. So these are the statistical tools that we use to describe our data. And these are just simply to describe our data. They cannot be extrapolated to the source population and cannot be used for conclusion and recommendation. Please don't forget this. We don't give any sort of conclusion or recommendation based on the data that we get from descriptive analysis. For example, here we have 59% female. So let's say if we are studying lung cancer, since the population but suddenly, just a coincidence, the majority of the population we studied are female. So we can't say it's just a coincidence. It doesn't mean anything. It doesn't tell us being a female is associated with lung cancer. It's just a simple coincidence. So if we have 59% of the female, we can't say that females are more vulnerable for lung cancer, because this is descriptive data, it doesn't show us if there is a true relationship or not. So we don't give conclusion recommendation based on this, because most of the papers that I see that in Ethiopia, people usually give recommendation based on a simple descriptive data, and which is not right. So please avoid that. The second level of analysis is comparative analysis. And in comparative analysis, what we're trying to see is some sort of pattern, difference, or a relationship. So a relationship means in the context of if there is any sort of pattern, similarity, or difference between two variables, not if one variable causes another variable. So the tools that we use to do comparison are chi-square test with cross-tabulation. I'm sure you all are familiar with this. And t-test, ANOVA, and correlation analysis. It could be t-test and ANOVA, they have dependent, independent groups, and correlation analysis, they have dependent, independent groups. These are called normally parametric, for correlation analysis, we have Pearson correlation or Spearman correlation. And these are parametric tests which we apply when our data is normally distributed. And our data meets our assumption. When in the absence of that, we have an parametric tests. For each, we have non-parametric tests that correlate each of these parametric tests, which we will see in the subsequent webinar. So chi-square test, t-test, ANOVA, correlation analysis like Pearson, Spearman correlation, all of these tests are tests that are used to see if there is a difference or similarity between the groups. So based on this, since we accompany our difference or similarity analysis with a p-value, it has some sort of generalizability, which is partly, but we can't say that X or our exposure affects Y. So again, even if there is, it gives us more perspective than a simple descriptive analysis, we can say that there is a cause and effect relationship between the two variables. So it cannot be used again for conclusion or recommendation. So please avoid using comparative analysis results to give a strong recommendation. It just shows us if there is a possibility of relationship, nothing more. So every clinician's interest is to see if there is a relationship between two variables. So this is building relationship using inferential statistical method. So in this case, what we are interested to see is if X affects Y. So in this case, if we want to identify important factors that affect our outcome, then we have to do regression analysis. So by doing regression analysis, we will get to see if there is a presence or absence of relationship between variables, and we will also be able to measure their strengths of association using measures of association, which we have covered on the second webinar: odds ratio, relative risk, hazard ratio. So if you get to see terms like odds ratio, relative risk, hazard ratio, and regression analysis names, that means someone has conducted a relationship analysis. So we can feel comfortable to say that this result can be generalizable to the source population. Therefore, we can conclude and recommend our result. So our conclusion and recommendation should be based on the result that we get from the regression analysis. So if there's anyone writing a research article, please make sure that your conclusion and recommendation are based on the results that you get from the regression analysis and not from the comparative analysis or from the descriptive analysis. So to see the basic principles, as you have seen in this table, the most important thing in data analysis is to be able to select the proper statistical analysis method. But to do that, we have to be able to identify the level of analysis that we have to conduct. So we have different statistical analysis methods. We have to pick the proper one for our data. But to do that, we have also to pick, to understand how many levels of analysis am I supposed to do? Is it just descriptive? Do I need comparative? Do I have to do further analytic or regressional analysis? So after identifying this and after picking the right statistical analysis method or tool, we can run our analysis. But before that, to select the proper statistical analysis method, what we need is a scale of measurement. So picking up your proper analysis method, which one is right? Is it mean or is it proportion? Is it chi-square test or is it ANOVA? Is it which regression analysis? Is it binary logistic regression analysis or linear regression analysis? So to pick the proper analysis tool for your study, what determines it is the scale of measurement of your variable. If you remember the scale of measurement of a variable, it can be a simple number, which is on a continuous scale. For example, weight of a patient. So it can be a continuous variable, or it can be account data. Numbers can be divided as a continuous variable like weight, or it can be account data only, which only integer values, whole numbers. For example, length of hospital stay, that can only 1, 2, 3, 4 days. It doesn't assume a decimal place. It can be categorical variable. So if categorical variable, it can be just a simple yes or no, or just simple labels, which is what we call nominal. So yes, no, or religion, Orthodox, Muslim, Protestant, something that doesn't have any natural order, but just sort of classification. Or it can have it can be something that has a natural order. And to achieve the higher order, you have to go through the orders before that. For example, we call these variables ordinal. For example, the stage of a disease. So for someone to reach to stage 4 of a cancer, they have to go through stage 3, stage 2, and stage 1. They can't skip from one stage to another. So this is simply a scale of measurement. We have talked about this in the previous webinars. Please go and refer that. So when we talk about scale of measurement, there are two things. The first one is we might not analyze our data based on the original scale of measurement that we collected the data. For example, for age, one of the tips that we have seen previously is numeric variable has to be collected as a numeric variable. So normally we just go on and ask the study participant, how old are you? So we just ask for the age, for the 6, 37, 12, stuff like that. But when we are going to analyze it, we usually prefer to categorize it into groups so that it can give us more analyzable category based on which we can make a decision. So the scale of measurement for age changed from a numeric scale or a continuous scale at the beginning of the data collection to a categorical, a nominal or ordinal data after for the purpose of data analysis. So the scale of measurement that we are going to look for is the scale of measurement that we are planning to use for data analysis. So for age, if I'm planning to use it as a categorical variable, then the proper statistical tool that I should use is the tool that we use for categorical analysis summarization. But if I decide to keep it as a numerical variable in its original data collection scale, then the proper statistical analysis method that I should use to summarize it is the one that we use for numerical variables. So we have to make sure that, am I going to stick to the original scale of measurement that I used for the data collection, or am I going to change it into another scale of measurement for the purpose of data analysis? So we decided that we have to use the scale of measurement that we want to present the result with. So the other is to identify the level or the level of analysis or the step of analysis. We have to have a very good knowledge of the study design of our study. So if our study is not properly designed, we can't identify the level of analysis that we have to conduct. For example, if I choose cross-sectional study, I'm not supposed to do comparative analysis, but if I choose case control study, I'm supposed to do this one. If I choose a simple descriptive cross-sectional study or survey, then I'm not supposed to do the comparative analysis and the relationship analysis. So we have to have a good understanding or of our study design, or we have to design it properly. So in addition to the study design, our objective is also equally important, because our study design and our objective go hand in hand. Our objective can be changed based on our study design. We will see it. And these are very important. And the last one is the very important, the beginning of all, is to have a good research question. Without a good research question, all of these things cannot be met. So make sure you have a good research question and have a good study objective, a clear study objective. Then pick a proper study design to meet your objective. List out all of your variables properly, both the exposure and the outcome. and decide what scale of measurement that you want to use for the purpose of analysis and reporting, and identify the level of analysis. So it seems like the last two stages are very important. Yes, they are, but in a properly designed proposal, it shouldn't be a problem. These choices are going to be automatic. If I have a good research question, a clear study objective, proper design, and if I figured out all of my variables with their scale of measurement, then identifying the level of analysis and selecting proper statistical analysis method should not be a problem. So just to show you an example. Okay. I'm sorry. So this is one article that's on COVID-19. It says laboratory biomarkers of COVID-19 disease severity and outcome findings from a developing country. So this research is interested, so the research question is which laboratory biomarkers are significant predictors of COVID-19 disease severity and outcome among COVID-19 patients in Ethiopia. So we have used a cohort study design, and we had 429 participants. So you can read the details since the link is available on the slide. So what we did is, before we started the analysis, further to answer which laboratory parameters are significant predictors of disease severity and death, we had to present the basic characteristics of the study population. So we started by describing the COVID-19 disease severity and outcome, which are our two outcomes. Our study had two outcomes, COVID-19 severity and disease outcome. So we presented from the 429 patients, how many of them died, how many of them had severe disease, and stuff like that. So as you can see here, this is a simple count, this is a proportion, and since this is an outcome, we can consider it as a prevalence. So it's just simple counts and percentage, nothing more, no p-values. It's just a simple description. And after that, we presented the socio-demographic characteristics and underlying clinical characteristics. It's just a simple presentation of how many of the studied population were older, how many of them were males, and stuff like that. You can read this. So second, on the third label, we have analyzed, again, this is just a descriptive analysis, the baseline laboratory biomarkers. We presented their findings. So after that, as you can see, this is the table that I have shown you the narration for above. So you can present it this way. And second, here, I'm sorry, on the publication, the tables and the narrations don't come side by side. So the second level of analysis, which is comparative analysis, the one is, we did a comparative analysis for based on the COVID-19 severity. So we have non-severe groups, and we tried to see if these groups had a significant difference based on some of the characteristics of their study variable characteristics. So we have compared them based on their morbid illness, their laboratory values, and have tried to understand if there's a significant difference. So we can say that, for example, here, this is a chi-square table, by the way. You can tell it's a chi-square table because we have 2 by 2 categorical variables with p-value, and this is a chi-square results. And as you can see, the percentages are raw percentage. You can also refer this, I'll give you another material. So you can see that here, among the no cardiac cases, most of them are non-severe cases, and among patients who are cardiac, with cardiac disease, most of them had severe disease. So if this is going to have, and the p-value that we get is less than 0.05, which shows as a very significant association between having a cardiac disease and COVID-19 disease severity. So it's saying that there's a tendency for cardiac patients to develop severe disease as compared to patients with no cardiac disease. But this is not conclusive, and this doesn't show us if cardiac disease causes or results in COVID-19 disease severity. It just shows us a pattern. So to confirm this pattern, we have to do regression analysis. So on regression analysis, here we have control for other confounders, and we have run a proper regression analysis for our outcome. So here, based on the result that we get here, we can conclude that if there is an important, a significant association between the variables. As you can see, cardiac disease is not even included here because it didn't pass the variable selection criteria at the beginning, which we will cover in the future. If it confuses you, it's okay. So it shows us age is a significant variable. It's saying that older age group is associated with more risk of developing severe disease from COVID-19. And it's saying that having fever, presenting with fatigue, and having neutrophil to lymphocyte ratio of about 3, and SGOT value and sodium and potassium values at the beginning, they have a significant positive predictive value that shows that patients might develop severe disease as compared to those who do not have these exposures. So these are this is a regression analysis based on which we're going to conclude and recommend accordingly. So these are the level of analysis, just simply to show you. But now I want you to involve in this. So let's do some practice. So to have a complete understanding, let's speak. This is my research question. Does gender affect COVID-19 vaccine acceptance among adults in Ethiopia? So write this research question down and let's go through it together. I hope you all wrote it. So we want to know if gender affects our COVID-19 acceptance among adults. We want to see if there's a difference between male and female in COVID-19 acceptance, so that if we need some sort of targeted intervention, we want to intervene. So the first thing what I do is, by the way, the principles that I brought that I wrote here are not from a book or something. These are principles that I follow, and this is something that I have learned to be very important through my practice. So these are not just a very strict principles, but it's something that can guide you into writing a very good article, and this is something that I follow. I have to tell you that. So the first thing I do is when I have a research question, I try to visualize how I want to address this, what kind of population I want to gather. Is it I mean, would I be interested in having one large population and study how many of them are male and how many of them are females, and how many of them accepted the vaccine, how many of them did not? Or is it better to start with those who accepted the vaccine, recruit them, and those who do not accept the vaccine, and then try to compare the two? Or the other option is to start by recruiting like 100 female and 100 male, and trying to see if there's a difference in their decision to accept COVID-19 vaccine. So which one do you prefer? Which study design? Is cross-sectional better, case control, or cohort to answer this research question? If we get that straight, then doing the rest of the things is easy. So which one do you prefer? On the chat, you can drop it on the chat box. Cohorts, okay. Cross-sectional, okay. Any different idea? Most of you are saying cohort, cross-sectional, cohort. Cohort. So by cohort, we're saying we want to have case control. Okay. Okay. This is nice. So personally, I prefer either case control or because cohorts, we have to save cohorts for something more complicated. I mean, this is gender, the exposure status doesn't change over time, and it's something that doesn't need a very long duration follow-up. Maybe at this given point, and how many of females accepted it, how many of females do not accept it. To answer that, I think a simple cross-sectional study would be enough. But if we want to make the strength of evidence that we get from our research more credible, we can go for the case control. So let's pick a cross-sectional study and let's go with that. So cross-sectional study, let's say our sample size is like 400. We're going to go and pick 400 random samples from the study population, irrespective of their gender, irrespective of their vaccine acceptance choices. So we just pick 400 people. So the second thing to do is to have our to write our study objectives. So because our study objectives and our study design guides the level of analysis that we want to do. So we want to do analytic cross-sectional study. And what are our objectives going to be? We have seen that we can have descriptive objectives and we can have inferential objectives. So the first one will be what? Our outcome variable is COVID vaccine acceptance, right? So vaccine acceptance is our outcome variable and our exposure is sex, but we're now going to study just gender. We're going to entertain all other potential confounders, their educational status, their age, their medical history, their if they had been infected with COVID previously, and many other variables. So what's okay, the first objective, the descriptive objective, is going to be to determine. The first objective is going to be to determine the prevalence of vaccine acceptance. How many of them accepted the vaccine? The second one is to identify factors that affect COVID vaccine acceptance. So we want to know how many of them accepted it overall, the percentage, the prevalence, and then we want to identify factors that affect it, including sex and all other potential confounders. So let's list out all variables with their scale of measurement. So what variables should we consider? We have said that the COVID vaccine acceptance is our outcome. So our outcome is vaccine acceptance. What should our exposures be? The one that we stated our hypothesis with is sex. So education, you can drop them on the chat box. Age, great. Okay, education. What else? Sex, education, occupation, great. Occupation. Occupation. Good, right? Okay, what else? Level of understanding can be considered as education or residence, great. Health literacy, great. Marital status, great. Place of residence, urban, no. Rural, marital status, previous COVID infection. Some people with previously infected and had gone through some sort of trouble would definitely prefer to get vaccinated compared to those who had never been infected. Comorbidity, very interesting, right? Those with high risk factors will tend to get vaccinated. So comorbidity, their medical condition. Thank you so much. Pregnancy, rumors. This is very nice. Previous immunization history, religion, wonderful. So if we keep the webinar going for another 1 hour, we can write a complete, great attitude. We can complete an entire proposal. This is a very nice team. Thank you. So we have all these factors. So after identifying those, we have to decide the scale of measurement that we want to use for analysis. So COVID-19 vaccine acceptance, it can be like yes or no, right? So this is going to be a categorical variable. We're going to present it using percentage. So for gender, it's going to be male, female. For education, We can use cannot read and write, primary, secondary, above that, and others. Occupation, the same thing. Place of residence, we can either use it as urban, rural, semi-urban, or we can put the different regions by their name. Marital status, the same. Previous history of infection, comorbidity. We can use comorbidity as those who have comorbidity and those who don't have any comorbidity, or we can put the details of the comorbid illness. And age, for age, we should collect it as how old are you, just as a numerical variable, but for the purpose of analysis, if we intend to use it as a categorical variable, we have to label it as a categorical variable so that we can pick the proper summary measure. So on the chat box, something about conceptual, okay. A conceptual framework is just something that we use to show at the beginning of our, while writing our proposal, something that we try to show if how our variables interact among each other and with the outcome, our independent variables. That is going to be proved or disproved with our analysis later. So it's not something that will tell us if there is a relationship or not. It's just a hypothetical framework which can present our thoughts on the relationship of the exposure and the outcome variables and the exposure variables between themselves. So it has got nothing to do with the outcome, but we will cover it. So the level of analysis that we have to do is we have three options. It can be either just describing it and stopping there. We can do comparison between important sets of groups. And the last one is to do regression. So am I supposed to do descriptive statistics? Am I supposed to do descriptive statistics? Yes, yes, right? Any research should start with a descriptive analysis. Am I supposed to do comparative analysis? This is a cross-sectional study. I did not start by classifying the groups based on different variables, based on their exposure or their outcome status, but I can still do some sort of comparison. For example, I can say that those who accepted the vaccine and those who did not accept the vaccine, what does it look like, their baseline characteristics based on their age, their sex, and other factors. This is something that I can do as a comparison, as a preference, but it's not necessary to show, but we can consider it if we don't want. It's not mandatory. We can skip this stage. So am I supposed to do regression analysis? Regression? Definitely. Thank you. How do we categorize age? That is a data management session, a data transformation technique. You can go back and refer data management section. For regression, yes, right? Our study, our hypothesis, our research question is, does gender affect COVID-19 vaccine acceptance? So we want to see if gender has any effect on COVID-19 vaccine acceptance. To answer this, we definitely have to do regression analysis. So after going through this process, the final one is to select the proper statistical analysis method or tool that we should use. So at this stage, we have figured out everything that we want to do. We have a clear objective. We have sorted out our study variables with their scale of measurement, and we have identified the level of analysis. Now, picking this will be like just going through some sort of manual and putting a label. For this, I'll use mean. For this, I'll use median. For this, proportion. For this chi-square, for this t-test. These are very easy and simple things that will come, that will become at the tip of your finger with just a few practice. So this is how you should go through the process of selecting your practical technique. So I think since we have time, let me give you time to discuss. Let me leave the floor for discussion. And okay, specific how we categorize with ordinal regression. I think all of you, it would be great if all of you can look into the chat box because things are being dropped there. So categorization can be done in different ways. This is a data transformation method. Maybe since we're going to cover each of the three groups in the subsequent webinars, we're going to see how we categorize it and how we analyze it there. But from today's session, okay. No, you must have joined us a little late. For descriptive research, yes, we can give conclusion recommendation, but the recommendation, the conclusion that we give should not be as if there is some sort of relationship between our variables. Descriptive analysis doesn't tell us any sort of relationship, any sort of pattern, so we can't conclude or we can't recommend as if there is a relationship. By the way, when we conduct descriptive research, to begin with, we have to have a very good justification, unless it's a problem that's not studied very well, it's something novel, or if it is, unless it's some sort of experimental study where its preliminary findings are important, we shouldn't do descriptive analysis as a research, because descriptive research is a research where we get a summary of a group of variables. To get that summary of group of variables, you don't have to do research. You can get that kind of data from an electronic database or from some sort of authority offices. So I'm not a fan of descriptive research unless you have a very good justification for doing it. I have one descriptive research about COVID-19, not purely descriptive, it has comparative component as well, but still why I conducted it is because it's about COVID-19 among children. Since we didn't have a lot of admitted children at the time in Ethiopia, since the disease was mild and mostly asymptomatic in children, we didn't have cases. It's a novel disease. So with the limited number of patients that we had to show the pattern of the disease in the pediatric age group. That's why otherwise it wouldn't make any sense to do descriptive research. Yes, whether binary outcome or ordinal, metonymic, whatever, these are regression. In general, regression analysis, we'll get to see them on regression analysis webinar in the coming webinars. Yes, shall we include the outcome variable vaccine acceptance itself in the study variables? I mean, it's a question to ban. Yes, study variables, there are two types of study variables. The first one is our dependent variable, which is the outcome that we're studying, in this case, COVID-19 vaccine acceptance. And we have independent variables or exposures, factors that we believe are going to affect our outcome. So yes, we're going to present summary measures, we're going to compare it, and we're going to do regression analysis for the outcome as well. We can do, I mean, yes, we can do cohort analysis for this research question. Someone texted, why do you prefer cross-sectional over cohort? I mean, cohort takes a while to get your results. It needs a more organized setup, but to reach to that conclusion for this particular research question, cross-sectional is enough. We can get a very good result with cross-sectional study. We can save, thank you, somebody, yes, we can save our time, we can save our resource and get a very good result. It doesn't have to be a cohort design, because especially considering how important the problem is that we want to solve it right now, we don't have to wait a very long time. So rather, it's better if we do a cross-sectional study and get an understanding of the problem. It's not a very, I don't know, having a temporal relationship might not be that necessary in this case. Yeah, at a point of time and place, cross-sectional design means that. Thank you. By the way, you can raise your hand so that I can unmute you and you can ask. It doesn't have to be just a text. Emma, you can give them that option, right? ሁሌ አንድ ሰው ነው የሚያወራው ዌቢናሩ ላይ ነው። Maybe you can give permission. Is there anyone who would like to ask?
They can raise their hands.
Okay, great. Anybody, any other question? These are just things, okay. Thank you. Data analysis and data management are very important. Surprisingly, mostly during our master's program, most people are not confident doing these things at the end of the program. So they'll just keep asking, what should I do after they collect their data? I have seen so many people who ask that question after they collect their data. But as you have seen, data analysis and data management are something that we do after our data is collected, but both of these things should be planned at the beginning of the proposal. So after we collect our data in a way that can interfere with our data management and analysis, it will be a problem. So I usually don't like advising students who come up with just a data and so that they want to answer their research question. Believe me, like 99% of the time, the data has to be collected again because these people did not consider the nature of the variable, how it's going to affect their analysis. The study is not properly designed. The research question has a problem. So it is going to be one of those, what we call a trashy research. So it's very difficult to correct that one. So always my philosophy is spend 75% of your time on your proposal, figuring out everything, and then spend 20% of your time on data management, making sure that your data is suitable for analysis. And lastly, just allocate 5% of your time for analysis, because a very well-written proposal and a well-managed data can give you, can make your data analysis very easy, something that you can do in just few hours. So always give more time for those things. Videos of the previous, I think Emma can share you the rest of the materials. Operational definition, yeah, what about that, Alamayo? Thank you, Samuel. A very interesting explanation. For most research questions, before diving into something longitudinal that is going to take time, it's better to start with a very small scale studies, feasible studies like cross-sectional studies, and then going to the large scale studies, depending on the result that we get. Very, very smart explanation, Samuel. Thank you. Why does public as a specialist criticize cross-sectional studies? Amanuel, it would be really nice if you can talk. Why do you think it is? I mean, any study design should not be criticized if it is properly selected. But in our setup, since the minimum requirement for a master's program fulfillment is, since you have to do analytic study, since you have to do regression analysis, the easiest from those is cross-sectional design with a binary outcome. So people usually stick to it irrespective of irrespective of the proper way of, even if their research question needs a different approach, they usually stick to the cross-sectional design with a binary outcome to make things easier. So personally, I get irritated when I see cross-sectional studies which are improperly utilized. Otherwise, every study design has its own place and time, and using it in a proper place will make it always correct and good. Now, for example, in this example, I prefer to use cross-sectional design because it's efficient and it can give us as good results as the other designs, and we shouldn't waste our resources on the others. So I think if you have any question, you can drop it in the chat box in the meantime, and Emma can share you the quiz. Great. Zalalam, I think you'll benefit more from the slides on the Medical Research Lounge Telegram group. For every regression analysis that you want to do, there is a step-by-step guide on how you run it on using spaces and how you interpret it. So maybe you can, I can get the link for you. Maybe you can refer that, since you are interested in ordinal regression, you can get that from there. Like, I have a good paper on, okay. ደሳለኝ የጠየቀውን መመለስ እንችላለን። ሪትሮስፔክቲቭ ኬስ ኮንትሮል great. Survival analysis is a regression analysis form, so we will see that during regression. For Zalalam, this is a link for Zalalam, the one who asked for, oh, I'm sorry, let me make it for everyone. The one who asked about ordinal logistic regression on survival analysis as well. Okay, I think it would be great if I give you the topic menu. This is the topic menu, and on the menu you can get all topics on research, data management, and analysis, specific analysis methods with a species demonstration. So you can access it from the link there. Okay. Emma, I think you can share them. Yes, post it. If you have any question, you can drop it on the chat box. I'll see it. You can go to the quiz now. I think I'm sorry for interrupting. I don't have anything to add. This is all about today's session. If Emma has something to say, I'll give it to you. Thank you very much, everyone, for your participation. Have a nice time.